Good afternoon, everybody. My name's Wendy Fenton, and I'm the coordinator of the Humanitarian Practice Network here at ODI. And I'd like to welcome you to HPN's the Humanitarian Practice Network here at ODI, to our first webinar, which will focus on the humanitarian consequences of violence in Central America, which was the theme of the 69th edition of the Humanitarian Exchange magazine, which was launched at the Wilson Center in Washington, D.C. on the 8th of June. Now, over the last decade, organized criminal violence in Central America has resulted in some of the highest homicide rates in the world. And vulnerable communities in the Northern Triangle countries of Guatemala, El Salvador, and Honduras have been forcibly displaced within countries, across the region, and then northwards into Mexico and the United States. And as Jan Egeland notes in the lead article he wrote for the Exchange, violence is on a scale unprecedented for countries not at war. But there's a certain reluctance amongst states and aid providers to acknowledge the humanitarian dimensions of this crisis. The violence is causing forced displacement of entire communities, interrupting education, preventing access to basic medical services, and compounding issues such as sexual violence as well as child recruitment. The large-scale impact of this violence, the most visible of which is forced displacement, requires a coordinated humanitarian response that provides better protection and assistance for communities. And so some of the overarching questions that we want to discuss today are: what can humanitarians do to provide greater assistance and protection to victims of violence in the region? And how can aid agencies identify and assist people without putting them or assistance providers in danger or in more danger than they're already in? So before I introduce the panelists, I just wanted to emphasize that all of those who are watching us online, that you can submit your comments and questions as they occur to you in the discussion box at the bottom of the video screen. And we'll try to address as many of them as we can during the question and answer session. We're going to spend about 40 minutes with our panelists, and then we're going to open the floor and try to address your questions. Also, please feel free to tweet. The webinar hashtag is ViolenceSentAm. So that's ViolenceSentAm. So now let me introduce our very interesting panel of speakers who are joining us from all over the world. So first of all, joining us from Switzerland is Wendy Q, the head of the Latin America and Caribbean office of UN OCHA, the Office for the Coordination of Humanitarian Affairs. Wendy has more than 20 years of international and UN experience in humanitarian affairs, human rights, and sustainable development. She's led UN emergency teams and coordinated initial responses to the tsunami in Sri Lanka, floods in Pakistan, a volcano eruption in Cape Verde, and hurricane in Haiti. And Wendy, who's based in Panama normally, is also one of my co-editors for the Humanitarian Exchange on the humanitarian consequences of violence in Central America. And she co-authored with Vicente Raimundo Núñez Flores from ECHO an article entitled "According to Need, Humanitarian Responses to Violence in Central America." Then we have Christian Visnes, who is the director for the Norwegian Refugee Council in Latin America and has 20 years of experience in the humanitarian sector, 10 of these in Colombia, from where he joins us now. From 2010 to 2013, he was the regional representative of the Norwegian Red Cross in the Americas and has also worked with UN OCHA and UNHCR in Latin America and the Middle East. As I mentioned earlier, Christian's colleague Jan Egeland, the Secretary General of the Norwegian Refugee Council, contributed the lead article to the Exchange entitled "Central America at the Tipping Point." And then joining us from Spain, I think from Barcelona, is Marc Bosch Bonacasa, who's the program manager for Latin America at Médecins Sans Frontières. Previously, he was MSF head of mission in Mexico, where he led MSF's healthcare response for Central American migrants and refugees. This included treating victims of violence and sexual violence in Mexico and providing mental health care for people fleeing violence. Mark's previously served as head of mission in Ecuador, India, Zimbabwe, Colombia, and Yemen. And Mark co-authored with Elena Estrada Cocina the article Forced to Flee, the Humanitarian Crisis on America's Doorstep. And last but certainly not least is Noah Bullock, the executive director of Foundation Cristasal, who joins us from El Salvador. Foundation Cristasal is a non-governmental human rights organization based in El Salvador. Cristasal conducts research on human rights and security issues, provides specialized assistance to victims, and implements a rights-based community development program. Cristasal is currently working with regional partners to build a displacement monitoring system in the Northern Triangle. Noah's article for the Exchange is entitled Towards a Response, Addressing Forced Displacement by Violence in El Salvador. So I urge you all to have a look at those articles when you have a chance. So I wanted to, as I said earlier, to start the discussion with a few questions of my own before opening the floor to the rest of you. So I wanted to start with Wendy. Wendy, when we look at the statistics in the Northern Triangle of Central America, Honduras, Guatemala, and El Salvador, the three countries have the highest homicide rates per capita in the world, 8 times higher than the global average. Violence has resulted, as I mentioned earlier, in the forced displacement of entire communities, sexual violence against women and girls, widespread child recruitment, lack of access to life-saving medical care, and basic education. But despite the scale of the violence and its impact, widespread and devastating, many still question whether this is a humanitarian crisis at all. So can you tell us, why is there a reluctance amongst governments to acknowledge and frame responses to the humanitarian dimensions of this crisis?
Thanks for your question, Wendy. And precisely this is the issue we're trying to address, Vicente and I, in the article. It's a refrain we picked up from a long-standing debate within the community, which is how do we professionalize the issue of needs assessment? Can we actually identify indicators and thresholds that allow us to compare across countries and crises that there is a comparable level of need in this region? And what we're arguing is that indeed we do see the impact. I think one of the challenges in the region is the visible impact of the crisis is more what's happening outside the borders. You see people fleeing, asking an increasing number of asylum seekers, migration due to violence. And yet what's happening inside these two countries is also can be determined as humanitarian, but less evident perhaps. We have to say that humanitarian emergencies are not solely characterized by atrocities or deprivations that do happen, but also what does not happen when people can't access healthcare or education, for example. And we've seen in El Salvador in 2015 that more than 39,000 students had to leave school because of threats of violence or gang recruitment. This is 3 times the previous year, 2014 figures, and these figures come from the Salvadoran Ministry of Education. So we have a challenge where it's a complex, multi-causal factors of vulnerability and need. There's recurring natural disasters in the region. We've had consecutive years of drought. It's a what we're calling non-conventional violence situation. So it's not determined as an armed conflict, and therefore international humanitarian law is not often cited as applicable. And besides the issues of internal displacement and migration, we have needs because of lack of access to land. Land rights is traditionally an issue in the region. There's high levels of impunity, high levels of inequity, and poverty. And this leads to your question about why are governments not asking or recognizing that there is a humanitarian dimension to what's happening. And I think there are several factors. I'm going to mention 3, and then I'm going to come to what is of most concern to us, and that is the kind of lack of request for international or more international humanitarian assistance providers. I think that we must recognize that there are different government responses, and the governments are doing what they can, given the constraints that they're faced. We saw in the recent OECD report on understanding violence, when they talk about the states of fragility, how violence affects many factors of states' ability to meet the challenges associated with violence. We see that there's a limited ability for them to allocate resources to some of the underlying social reasons and causes, and a lot of what's happening is beyond the control of the governments in the region. It has to do with, for example, migration policy, United States migration policy, activities of international illicit criminal gangs and networks, trafficking of drugs, and trafficking of humans along these routes. And also to recognize that both El Salvador and Guatemala have gone through conflicts in the 80s and 90s. And their governments may be eager to demonstrate that they are still viable and functioning and understandably concerned about possible foreign interference. And I think this comes to the issue that we're most concerned about, that there's not a public recognition or request for international humanitarian, because there might be a conflation between the idea of humanitarian assistance brought by external resource or expertise and the idea of humanitarian intervention. And unfortunately, this has become increasingly politicized in the Latin America region over the recent weeks. But we know that humanitarian assistance can be made available in different ways, either through local and in-country actors, and providing, as I mentioned, technical assistance and ensuring a better linkage between ongoing development and security programs and humanitarian assistance. And I think this is the focus of the special edition and what we're trying to advocate for.
You've got a very interesting figure in your article, which highlights the kind of comparisons between the impact of the violence in Central America and in other parts of the world. And I just wondered if you could say a little bit about that, because I think many people don't realize, or they think, oh, the situation, I mean, we're talking about very few people really. Why is this an issue of international concern? And I wondered if you could just talk a little bit about that for the benefit of our audience.
Sure. The comparative table illustrates that 3 countries have some of the highest homicide rates in the world, comparable to civilian deaths in many of the largest conflicts. So comparable or even exceeding the conflict casualty figures in, let's say, Yemen or Iraq in recent years. And I think what we wanted to demonstrate is the human toll that the crisis is causing. As I mentioned earlier, the homicide rates is really just a proxy indicator for wider need. However, it does kind of show the pointy end of the problem. And you combine that with the high rates of impunity, and you know that the fabric of society is really impacted at all levels when many families either have directly been impacted by this deaths in their family or within their networks, and the threat of violence is omnipresent for them.
And your article is called According to Need. And I wonder if you just want to say a few words about why you chose that title.
As I mentioned earlier, I think one of the seminal pieces that HPN had published before was According to Need, and about needs-based allocation of humanitarian assistance. And that was also one of the reasons behind the Good Humanitarian Donorship Initiative, which was that humanitarian donors should be not influenced by geopolitical reasons, but rather, or by, let's say, media attention, but rather on the evidence of needs. And unfortunately, we see over and over again that this is still insurmountable in many cases, that there is more funding and assistance available to conflicts or disasters that receive high levels of media attention. And so we want to bring it back to the idea that a person who is suffering from malnutrition or in need of international protection, no matter where they are, deserves our assistance.
Thank you very much. We'll come back to you later, but I wanted to move on to Christian. Christian, women and children are amongst the most vulnerable to the consequences of violence and forced displacement, and they're at high risk of both physical and sexual violence. So what are aid agencies like NRC doing in the region to provide protection to these victims of violence, and to what effect?
Well, I think we have been in discussions for years in terms of opening up an own operation. We are in displacement agencies working mainly in conflict situations. And I just wanted to echo some of the things Wendy said before, because this has been both an internal and an external debate. Is this a context where NRC should be working? And we have, as we've been able to set up an operation in Honduras now and working in in the areas, in the neighborhoods. This is largely an urban issue and an urban humanitarian situation. we have realized that this what we are doing here is really responding to one of the basic objectives of our work, which is responding to or saving lives. And when we are now working in neighborhoods in San Pedro Sula, which is one of the most violent cities in the world, what we have seen is that children and women are one of the most affected groups, and we are providing life-saving humanitarian aid, allowing them many times to displace. In a country like Honduras, what we're finding is that there are very few areas where you can find protection. That is why so many people leave Honduras and try to go to Mexico or to the United States. But still there is a high number of people trying to displace in order for them to save their lives. And when we are doing our intervention in some of the worst, where we are providing education, but also providing humanitarian aid with cash-based aid for families, entire families that have to relocate. So basically, what we are seeing now is that if they have the possibility to leave their neighborhoods, people and families that have received death threats, that can save their lives. For many families that don't have the resources to go on a migration trail, the only possibility left for them is to stay in the neighborhood, and that is many times the sure death for one of the members of the family, or one of the children being forcibly recruited into a gang, or maybe suffer sexual violence of some sort. So giving them cash aid, which is what we are doing now, is allowing them to seek protection somewhere else in Honduras. And we have seen that this can be quite effective. On the other side, what we are also doing is giving education services in the neighborhoods where they're living. Many families and children cannot move from one neighborhood to another because the neighborhood, the closest neighborhood is controlled by a different gang or armed group, you might say, and they moving from one neighborhood to another is putting them under an enormous risk. So providing education services in the neighborhood where they're already living is also reducing that risk from suffering from any of these very likely violations of the human rights to happen.
Thanks, Christian. And I mean, what's been the most challenging part of responding to this crisis, trying to implement these interventions?
Well, I think that there are several aspects here that has been challenging. As this situation has been largely framed as a development situation, to get the funding has been a real issue. These are countries, Guatemala, Honduras, and El Salvador, are countries that have seen humanitarian organizations working there for many years, but mainly they've been working on risk reduction for natural disasters. So what we see is that there's both a lack of technical capacity, how to work in a conflict-like situation, because in this continent we have been working in Colombia for many years, but starting up our operation in Honduras, what we've seen is that similar strategies that we are using in Colombia also work in Honduras. Many were very worried if we would have access to these neighborhoods that are controlled by gangs or maras. What we've seen is that using the same sort of strategies in terms of accessing them, we have been able to do that. So we can work in these neighborhoods, and we're working in the worst, the areas that are worst stricken by violence. So one of the things that we also have seen is that there is a great need for other civil society actors, other humanitarian organization, a national humanitarian organization, to learn how to operate in areas where you have extremely high levels of violence, and that is also we've seen been very, very useful. But I think to address this situation not only as a development situation, which it also is, but as a conflict-like situation, is clearly one of the ways that we have to address and to be able to deliver humanitarian assistance where the most vulnerable people are.
Thanks very much, Christian. Moving on to Mark. Mark, as you noted in your article in the Exchange, in a survey by MSF carried out in September 2015, nearly 40% of respondents from the Northern Triangle cited direct attacks, threats, extortion, or attempted forced recruitment as the reasons for fleeing their countries. Can you talk about the impact of forced migration on the physical and mental well-being of refugees and migrants, especially women, minors, and LGBTI individuals, and how MSF and others are responding to these needs?
Sure. Thanks for the invitation and the question. As you said, and our colleagues said before, mentioned it before, the violence that people is experiencing in the Northern Triangle is not unlike the war zones around the world. So murders, kidnappings, threats, recruitment by non-state armed actors, extortion, sexual violence, and forced disappearance are the daily burden of thousands who live in areas de facto controlled by gangs and maras and criminal organizations. Unfortunately, the violence does not end with the departure of these people from Honduras, Guatemala, or El Salvador, because once they arrived in Mexico, migrants and refugees are again victims of violence and all kinds of abuse. This violence and re-victimization, apart from immediate injuries and trauma, leave them with a serious emotional pain and mental health consequences that affect their well-being, their functionality, and their capacity to take decisions by themselves. If we look at our consultations, what we see is that 1/4 of our consultations in our Mexico program to assist population fleeing violence from the Northern Triangle, as I said, 1/4 of the consultations are related to physical injuries and intentional trauma occurred during the route to the United States. Besides this, the anguish and stress that migrants and refugees face both in their home countries and along the migration route make this population particularly vulnerable to anxiety, depression, and post-traumatic stress disorder. And the levels of post-traumatic stress disorder that we see in Mexico assisting people fleeing violence are similar to the levels of post-traumatic stress disorder seen in traditional conflict settings where MSF is working. Migrant and refugee women deserve a special attention when it comes to mental health, as data clearly show us that there is a particular vulnerability of this population. Nearly 60% of the women assisted by MSF have symptoms of depression, and nearly 50% are showing symptoms of anxiety. Other vulnerable groups, such unaccompanied minors and LGBT people, are often especially targeted by criminal groups and need greater support and protection. Besides, some of the patients treated by our teams report extreme pain and unbearable suffering due to physical and emotional violence inflicted as an extortion strategy. Patients refer to our psychologists and staff that they are being tortured and abused in order to force them to reveal contact information of their families, in order to request them with a ransom payment once they are kidnapped, Others are reporting that violence is used to psychological terrorize them or their colleagues to ensure that they will not report crimes to authorities or they will try to escape. So basically, these mental health and physical consequences of this cruel, inhumane, and degrading treatment are devastating for them. Their functionality is severely reduced. Survivors of violence are unable to continue their journey or take care of themselves. The need of a secondary and tertiary level of care is often required for those most affected patients, but it's not available or easy available in Mexico, basically because migrants and refugees are often not seeking assistance because they fear for their security, retaliation, or deportation, which could be linked to rumors of previous individual experiences of health staff that called migration authorities whenever an undocumented migrant presented to their structure. And this is happening in Mexico, despite it's not a legal requirement. Trying to respond your question, what else could be done, or what kind of assistance can be provided. I think that we have to mention that we have to go beyond what the humanitarian organizations can do in the Northern Triangle or in Mexico. Definitely, this crisis calls for an adequate allocation of resources from the governments, from the Mexican government, to ensure access to healthcare and humanitarian assistance, regardless of the administrative status of the patient. They have to address, and the system have to address the mental health care needs, the emergency care for wounded, and definitely to strengthen the medical and psychological care for victims of sexual violence by ensuring the implementation of adequate protocols in the health facilities along the migration route. This is fundamental to alleviate the suffering and to treat patients with dignity and humanity.
And Mark, I know that MSF has been doing advocacy work around this. Do you have many allies in the region who are working with you on this?
Yes, and MSF as a humanitarian organization in this context, we've been developing several strategies specifically to work in this context, and definitely the partnerships and the coordination with local NGOs and the civil society and faith-based organizations have been crucial to better response to this crisis. MSF is basically working inside hostels along the migration route, providing healthcare assistance. And those hostels are run by partners, and definitely this is a key lesson learned on how to operate in this kind of context. In terms of advocacy as well, we've been working with the partners. We've been gathering testimonies. We've been collecting and applying the survey together with the partners, and definitely this is a collective effort of different organizations, international and national, from Mexico, working in this crisis.
And I guess for both Mark and Christian, then I'm going to move on to Noah, who I know is involved with a number of civil society organizations. Do you find that in these contexts that you're working more perhaps with civil society organizations as partners than you might do in other contexts, or is it similar? We'll start with Mark and then Christian.
I say we are better engaged with local organizations, and this is something that MSF is not always capable to do in other crises. Sometimes because we are responding in acute crises where well, I mean, there are few organizations on the ground, but it's not the case in Mexico. I think that this is a distinction, a characteristic, a particular from this setting. Regarding this, I mean, other aspects of this crisis that are different or that we don't see it in other places. I would say that mobility and invisibility of the people assisted by MSF is also basically one of those main characteristics of this Northern Triangle humanitarian crisis, and this is also forcing us to better integrate with other organizations, spread across the route, and able to assist in partnership the population.
Thank you. Christian, did you have anything to add from NRC's perspective before I move on to Noah?
Yeah, I think I would also agree with Mark on that. This is a situation where we are working very closely with local civil society organization. There is, however, a need, I think, for our particular experience and an international humanitarian organization that's been working on protection in armed conflicts. I think you see many of these civil society organizations working with tools that are not appropriate for the kind of situation that they are facing, but which and what we've seen in these 2-3 years we've been active in Honduras is there is a great need for them to better equip themselves to work in these highly conflict and highly risky areas, where we at least in the short term we don't see that this situation would change in any positive ways. Where we would rather see violence be rising, and also these local humanitarian actors also be at high risk of being targeted. So though we see that it is extremely important to work with local civil society actors, we also see a need for adopting and supporting their approach to respond to this situation. Now in Honduras, there is only 4 or 5 organizations responding with actual humanitarian aid, life-saving humanitarian aid. And while many of the donors that are supporting this work are still focused on the developmental needs, which is also very important that they are addressed, very few have available funding to respond to the most immediate humanitarian needs, for example, displacement. And that is why we see that displacement is almost invisible. Very few people that are displaced inside of Honduras has any incentive to consider themselves as displaced, and most people that have access to any sort of resources would try to leave Honduras as fast as they can, because there's so little happening inside Honduras. And I would also like to add to that though in Honduras we see an important political will to address the situation, this has not translated into any actual measures or response to the displacement situation inside Honduras. So we see that there are positive factors, but that hasn't really translated in the short run into actual response to the situation, and that is extremely important to now scale up the response inside these countries where you find the most vulnerable people.
Thanks very much, Christian. I want to move on to Noah, and then we'll come back to Wendy after that. Noah, I think it was Mark who already mentioned that one of the characteristics of, I suppose, the crisis in the region is the mobility and invisibility often of people who are affected. And we know, in your article, you emphasize this point that there are many victims who have restricted mobility or who are in what is called confinement for security reasons. And can you tell us about some of the challenges Cristasal and others face when trying to identify and assist people in hiding without putting them or assistance providers in more danger?
Yeah. This term confinement is something that we've been using. It comes out of the case documentation that we've been doing for about 2.5 years. And it's a behavioral pattern of people who are facing persecution or threats of violence. And this is something that people do before displacement and during displacement, and also upon returning back to their countries, having failed to acquire a durable solution outside of the country. So when we're talking about displacement, it can be in the family's own home. When threats begin to ratchet up, people self-enclose. They don't leave their homes for fear of death or other forms of violence. And then once they make a decision to displace, they often use confinement in the site of displacement so that they won't be detected by organized criminal groups that control the zones that they've displaced to. And so that's one of the things that characterizes displacement in El Salvador specifically, compared to, let's say, a Colombia or another conflict region where people can displace from within a conflict zone to outside of a conflict zone, where then they can live in relative peace and generally begin to get access to assistance. Whereas in confinement, it's a continual and ongoing persecution and hiding, and that's what represents a specific challenge in terms of identifying and counting displacement in the region. A lot of the methodologies to try and get a quantitative number about displacement have confronted this challenge that people don't want to be found. They don't want to be counted. And so doing a census or knocking on doors and asking about displacement, people perceive that as something that might elevate their risk on their own. So as a humanitarian provider, you have to figure out a way, a space in which you can help people without putting them at risk or putting the organization itself at risk. Some of the things that we've done in El Salvador, addressing people who are suffering active persecution and serious risks, are safe houses. The safe houses have been activated by different organizations in a security environment in which people ultimately can't leave. It's still a confinement setting, and that's something that really needs to be understood as temporary. Oftentimes in El Salvador, the first response that people are even talking about, I think we're less developed in terms of building response than Honduras comparatively, but people are talking about shelters. And people who are fleeing violence have to have a specific type of shelter setting in which they won't be identified, and therefore the family members who are outside of the shelter won't be identified. And so that often means isolation. And those are things that have to be understood as a very short-term solution. And I think that kind of sets up our bigger problem, is that we haven't been able to figure out what to do with people in a quick and efficient way, even once they're in shelter settings. How do we get them out? How do we accelerate them towards durable solutions? Some of the alternatives that we've been developing here in the region are what we call open safe houses, sort of open. We call them casas abiertas, which can be houses in other parts of the country in which people have a slightly greater degree of mobility, but with still a security protocol in which we can then help them get medical, psychosocial, food assistance on a temporary basis. And we're also beginning to look at more community-based protection options. Those are things that in El Salvador have been very difficult because people are wary of people coming from other territories. And so this will take significant sort of development type assistance so that we could build host community that could, on a temporary or even longer term basis, host displaced people. We also think that can be something, community-based protection models can be something that we use in neighboring countries like Nicaragua or even Guatemala and Honduras to provide temporary assistance to people who really just need to leave their homes and get out of the country. So it's really a process of trying to generate options for people, and the confinement is something that people do because they fundamentally don't believe that there's a response. One of the things that has come up in multiple studies that we've done is this sense of people, victims of violence, they feel like they aren't subjects of rights. They say that over and over again. They say they feel that way in their communities of origin. They feel that way in the countries of transit, and they feel that way in countries of destination. That the expectation that a state would provide protection is almost non-existent among most of the people who we've spoken to. And so this confinement is illustrative of what people are feeling. They believe that their families are a network that can provide protection. They feel that the protection responsibility is something that they must assume on their own. And that's what puts them in these vulnerable positions when they begin to look for coyotes or human smugglers, and find themselves in those precarious situations in Mexico that Mark talked about. So confinement is definitely not something that we think is a good protection option, but it is the one that families tend to go to.
And thanks, Noah. But I think in your article also you emphasize that often it's families, individuals within families may be targeted, and Mark was mentioning also about the psychological pressure that's put on people because of extortion demands or threats, and that families prioritize protection based on the individual needs and vulnerabilities of the family members. Could you talk a little bit about how the strategies that families use beyond, say, the confinement of the family to deal with some of these issues?
The confinement is a temporary thing. What happens usually is that the neighbors detect them, or the organized criminal groups that control those territories protect them, so families are forced to look for the next step. What I allude to in the article is, ironically, families take a differential approach. They look at the different needs of the family members to try and find different types of options for them. So one of the things that we notice is that families who are displacing internally in the country with young adolescent boys often try and separate the boys from the family, because those boys are the ones that kind of attract attention from both the authorities, because they could be potentially gang members, or from gang members or gangs that control different territories, concerning that this might be an infiltrated gang member coming into our territory. So families will sometimes separate the adolescent boys from the rest of the family group and send them into hiding. We've seen cases where once we're able to reunite families again, boys who have been in hiding in those circumstances often have serious health concerns, because they've been cut off from even the broader family network. Another scenario that's pretty common is that they'll look at the younger members of the family, and they'll decide to send them unaccompanied to the United States to reunite with another family member who could receive them, while the rest of the family continues to internally displace and look for protection options in the country. So those are examples of sort of differentiated protection options that the families generate for themselves.
Yeah, no, that's very interesting, and I think it's those aren't necessarily the sorts of things that we may see in other contexts. Wendy, before we move on to the questions from the audience, I just wondered if you wanted to comment on any of the points that the others have raised from your perspective and the regional, in the coordination role within OCHA. Are you looking across the region? What are you seeing as some of the promising developments in the region on helping to support, people who are affected by this terrible violence?
Unfortunately, I don't see many promising developments. I only see more increasing challenges. As I mentioned, some of the politicization regarding humanitarian assistance and recent debates in the region make it more difficult. I think, though, it would be useful to focus on things that we can do, and what we're working on, 5 fronts, as it were. The first, as we're doing today, is to gather evidence, testimonies, provide evidence to raise awareness of the situation, to advocate for more presence of humanitarian actors and more financial support to the work that they're doing. Second is to advocate with the governments in the region that international humanitarian assistance is being offered on the basis of solidarity and does not in any way imply a lack of ability of the government or the state to respond or to use their own resources. We have the example of assistance to the refugee crisis in Europe that, again, does not imply that the government is a failed state or weak in any way. A third, we're looking at fostering what's been an increasing cry of the international humanitarian community to localize the response and to encourage international organizations to work more closely with local and community-based NGOs and civil society organizations, including faith-based organizations, especially in this region. The church is very strong. Fourth, we'd like to see much more collaboration between the different development and humanitarian and even post-conflict peace-building strategies. This has been promoted as a new way of working not only at the the World Humanitarian Summit last year, but by the new Secretary General of the United Nations, that we have to have a more joined up and integrated approach. And the need for humanitarian assistance in the region does not negate ongoing security sector reform or peace building or development efforts. I'd say the fifth and final step we would like to see is that we introduce a more humanitarian component to the debate in the United States right now about migration policy, that we are able to advocate for people to understand what's happening in these countries. Why are people being forced to migrate? They're not choosing to leave their homes and their lands. And what do they need in their countries of origin that they clearly can no longer have access to, and which we could perhaps provide in their countries so they're not forced to flee?
Thank you very much. That's a very good summary of key issues and approaches. I want to go now to our audience, and we have over 200 people who signed up to join the webinar today, which is really encouraging. So there's a lot of interest in what we're talking about today. I guess I'm going to actually go to Christian first. We've got a question specifically for you, Christian, from Viridiana, if I've pronounced that correctly. And that is, how can you ensure that the humanitarian aid based on cash is used for protection of families?
Well, that is, of course, always a challenge. What we do in these contexts is that we have a very close follow-up. And we have been working with this for families that have been displaced from San Pedro Sula, from a particular neighborhood. And these are efforts that we are just now piloting, so to speak. And as Noah also mentioned, in Honduras, in comparison with El Salvador, there is a larger space, and there is some areas of Honduras where you can find at least protection during a time, and there is larger family networks where they can also find some protection. But many times the lack of resources is what preventing them from moving from one neighborhood to another, where there is a minimum situation of protection. What we've been doing is, and in one particular situation where the father of the family was killed because he was resisting one of their children being recruited into an armed group, is that we provided cash so that they could pay for their living costs for the next 3 months, and this we can extend to, in some cases, for the next 6 months, and then they could provide for themselves in another area of Honduras where they can find protection. Is this a durable solution? No, it's not. We would really need the Honduran government and also other donors to provide or to support the government in providing durable solutions. But this is an intervention which we believe saves lives. Many times when a family receives threats, either of one of the children becoming victim of sexual violence or having to recruit into these are very, very serious threats, and they will be followed through. So if the family or the member of the family doesn't move, that will happen. So when we can support the family in order for them to move, we believe that we are saving lives. We need to do home visits and follow up in order for this to in order for the money to be spent for the protection need. But what we've seen both in our cash assistance and in many other instances of cash assistance is that the family usually chooses better than we do, or at least as good as we can do as a provider of humanitarian assistance. Now, cash assistance is not the only thing that we do. We also provide support for access to education. So when a family move, we also can support them so that their children also can access education in a new area where they reside. But this is many times a desperate response to a very, very serious situation where human life are a threat.
No, thanks for that. Yes, I'm interested in that question and your answer to it, having done a little bit of work here at ODI on cash-based responses and with the high-level panel. And it's interesting because often the response that you get to the suggestion that you could use cash in different ways, or you can use what we call multi-purpose cash, is that one of the things people will always say is that, well, cash can't be used for everything, which we would agree with, but they say, for example, protection. And so it's interesting that this is the lens through which your, this program has been looking at things. So thanks for that. Interesting. We have another question about from someone called Josu, if I'm pronouncing that correctly, and I think one of you mentioned this too. I mean, I'm just going to throw this question out to all of you and see who would like to answer, which is, how can faith organizations contribute to solving the problem, or what is the role of faith organizations, churches and others in the region? And perhaps you'd like to talk either from the perspective of the country you're working in now, or from a broader regional perspective. I don't know. Noah, do you want to start?
Sure. It's to be honest, it's the churches and really faith-based organizations that were the first ones to respond. I think part of that is because the church is one of the institutions that the population still has trust in. The people, I mentioned this earlier, overwhelmingly in the cases that we document, people don't trust the state to provide services or protection, and so they begin to look for options, right? And what we used to call it is ping-ponging. The people, when they began to exhaust their own family resources for protection, would go out and sort of knock on doors and ping pong around to try and find somebody to help. And the doors that they began to knock on were mostly churches and faith-based organizations. Our organization was founded in the Anglican Church, for example. In Honduras, you have the Scalabrinian networks, and you have other faith-based organizations as well responding. And churches are also beginning to be places where we can provide shelters on a temporary basis. And the churches, we think, going forward have an important role because of the network that they have. They may be able to be part of building more community-based protection responses, to be able to identify and work with communities to be able to develop durable solutions in the country and those community-based protection options I mentioned earlier.
I think you also mentioned in your article that, ironically, the lack of, I suppose, state response sometimes opens up the space for civil society organizations, religious organizations to actually intervene or try to help develop responses. Did I understand that correctly?
Yeah, I wouldn't like to think of it as an opening of a space. I think it was more like we responded when others didn't want to, when it wasn't on the political agenda, or internationally the situation in Central America was even less known. And so it's the people who have been working in communities for a long time who began to build those first responses. And ironically, I think a lot of our organizations, civil society and faith-based organizations, receive cases that are referred to us from the state itself. So this sets up a type of a conversation that we have to have with the state about national responsibility. It's a space that opens up not as a good thing. It's a space that opens up because of the lack of political commitment on the part of the governments to assume their responsibility for internally displaced people. And so while we are responding right now and working in what we call sort of constructive ways to build better capacity in the state to respond, ultimately it is their responsibility. And we want to see ourselves as catalyzing a greater national response rather than substituting or supplementing the state in its responsibility.
Thanks. Mark, do you have anything to say about the faith organizations? We can't seem to hear you.
Yes, I think that what is happening is that the states abdicate on the responsibility to assist population on the move. At least this is what we see in Mexico. And the faith-based organizations are running nearly all of the nearly 100 albergues that are scattered all over the country. And they are in charge as well of, becoming institutions that help migrants and refugees to access protection. So there is a vacuum and a lack of response from the state point of view that has been covered through a huge network of volunteers and people linked to those faith-based organizations. I think that this is the reality in Mexico, and I think that definitely we as international organizations are coordinating and are working together with those faith-based organizations. But I think that definitely in the mid-long term, it's a state who should take this responsibility, both in terms of protection and in terms of assistance, or at least providing enough funds and definitely avoiding criminalization like it's happening somehow now, and changing a little bit the way of approaching to this crisis. So yes, faith-based organizations are crucial to assist the population on the move, but this shouldn't be the long-term solution. For the long-term solution, the implication of the states definitely is needed.
I'm going to move on to another question. When I come to Wendy and Christian, if you do want to comment on any of the other questions that I haven't specifically directed at you, you're free to. But we've got a question from Maria Grazia Presaco, and I'm sorry if I've massacred your name. And she says, "Hi, I'm a Spanish Red Cross delegate in Honduras." And she has two questions. Number one, do the panelists think it can be feasible for some kind of joint system along the route to assist migrants? So I'm imagining that she's talking about across the region or through the different countries. And do they think anything can be done in order to make donors really understand that violence is a structural emergency issue in the area that needs to be addressed urgently? So those are the second one is a particularly big question, but let me start with Wendy on that one. What do you think?
Could you just repeat that second part of the question?
Sure. The second part of the question was, do the panelists think anything can be done in order to make donors, really understand that violence is a structural emergency issue in the area that needs to be addressed urgently? And the first one was about whether you think it's feasible for some kind of joint system along the route to assist migrants.
Okay, I'll focus on the second part of that question. And I think we've been trying to tackle it from different angles. And I think some of the challenges we have is that we're speaking mainly to our own humanitarian community. And we need to maybe look for sources of funding that come from beyond the traditional sources. As we've seen in recent years, there's increasing competition for more limited funding. And when you have high-profile, large, protracted crises as in the Middle East or now the famines in Africa, it's very challenging for us to have the same space at the table with the traditional humanitarian donors. So I think it's one is framing it, as I mentioned earlier, as a multifaceted emergency, and that the funding needs to come from different sources simultaneously. Second, I think there is increasing acknowledgement and awareness that this type of violence is not specific to this region. We're seeing a label of different criminal networks and even terrorism in some areas that are causing humanitarian needs that don't fit neatly into either traditional conflict or disaster scenarios. And I think working with partners on being able to, as I said earlier, provide evidence on how the impact of the violence creates similar vulnerabilities and thresholds that require assistance to be provided to the vulnerable people and people who need protection and assistance in the region.
Thanks, Wendy. Christian?
Yeah, I think on the first part of the question, I think one of the forms of resolving the problem is clearly a regional cooperation. I think also Jan Egeland in his article highlights the importance of this. And I think in the case of Latin America, there is already an opportunity for this. That they have their the Brazil Plan of Action, which is a 10-year plan for cooperation on the most important protection issues concerning displacement, refugees. So you already have a framework where you can work on regional solutions and regional cooperation, because this is clearly not only a national problem for the Northern Triangle. This it's a sub-regional problem that affects also the stability, I would say, in the region. So clearly, working regionally is one of the solutions, and then we have to work on in different areas. I think there already is regional cooperation, but not maybe addressing the most immediate needs. For example, for the people that along the route, how can we better provide humanitarian support people on the need that have very legitimate reasons to be on the move, when they, and as you can see in El Salvador, there is in fact very few places where they can seek protection. So rather than look to refocus this more on the needs of the people and not only see this as a security problem, would be an important change in the way these countries cooperate, and then you would also be better able to look at the root causes.
And Christian, I guess, I mean, there, in addition to the Brazil Plan of Action, there have been subsequent, I think, agreements or, agreements signed, plans of action or addenda to those agreements. But are the countries really taking action? I mean, do you feel like the governments, and this is a question to all of you, are the countries actually involved, actually taking up those commitments?
Well, to maybe start responding to that, I think there is not a one response to that. I think there are countries that have a greater awareness of this and a greater political will, and I would clearly put Honduras there forward as an example. When they have shown political will, they have recognized that they have internal displacement, and there is a legal framework now being worked at. But this cannot take years and years. I think this is an urgent issue, and that's where we see a void between the expressed political will and the actual political action. So I think that is nevertheless though positive, and we need to see other countries following suit. And also, we are of course extremely concerned that when the changes that we see in the U.S. the U.S. policy towards this problem, where we have seen a more balanced approach before. Now we see maybe at least when we see the discourse, a move towards more military means to address this problem than the social ones.
Thanks. I don't know, Noah, Wendy, Mark, do you jump in if you want to comment on that one?
Sure, I'll comment about your comment about political will and are they really responding. I think we have to have a bit of a nuanced approach in terms of assessing government response as well, because the governments themselves are diverse. In El Salvador, we have from the executive a level of recalcitrance in recognizing or being willing to cooperate on displacement and assistance to victims. That's I think surprising for most people. The government is at the executive level is very closed, but at the level of institutions that have mandates to provide services to victims or to the population in general, there's an opening. There, for example, the Women's Protection Institute, the Public Defender's Office, the Human Rights Ombudsman. These are people who are seeing the same thing that we are. They have the people knocking on their doors, asking for assistance, and there's greater openness to work to address those things. So the challenge there is to begin to do, to look at the ways, the protocols that those institutions have to identify internally displaced people and assist them, and build capacities of the operators. I think Christian mentioned that there's a lack of experience in the region on doing this, and that's true. I think we're introducing human mobility is not new to the region. That's been happening for a long time, but understanding the protection needs and the way that violence is driving that is new. And so helping states understand their mandates as they assist and identify internally displaced people is something that we need to continue to invest in, and then there's an opportunity there. Having said that, the official negation of displacement on the part of the Salvadoran government makes it difficult to go further into like a policy framework or a legislative framework that would be more comprehensive.
Thanks. Mark?
Yes, and I would like us as well to put to emphasize that the evidence regarding the consequences of the violence on the population in the countries of origin and transit is there. I think it has been very well documented in the recent years by Amnesty, by International Crisis Group. We launched a report recently providing testimonies, providing results of questionnaire surveys, medical data as well. I think that the point is that this crisis is heavier in terms of protection needs rather than assistance. And when we talk about protection needs, we talk about responsibility of the states involved. And I think that the states, are using a different narrative to approach this crisis. Are using a security narrative, are using a border control narrative, and definitely it's a way of minimizing what is happening or diverting the attention on what is happening. So I think that we as international local organizations, human rights organizations, humanitarian organizations, somehow are, fighting this narrative constantly, and it has to be done even louder if we want to succeed. Otherwise, we will keep talking about border control, deportation, security, instead of talking about protection measures, right to asylum, right to become a refugee, and the responsibilities of the countries of origin, but as well the countries, the governments of the countries of transit, and the responsibilities of the countries of destination. In this case, the U.S.
Thanks, Mark. Wendy, did you have any comments there?
I just want to jump in because, as Mark said, it is primarily a protection crisis, but there are still also assistance needs in those countries. The violence impacts whole communities and affects their access to adequate health services and educational services. And so I think what we're trying to advocate for is that, again, while there's a lot of focus and visibility about people that are displaced across borders, there's less visibility for the people that are affected within their countries and maybe don't have a chance to either cross borders or even become displaced within their own countries. First of all, there's no official figures about internally displaced in some of the countries. And second, as Noah had mentioned earlier, many don't have the option to go to a different location. So we also must ensure that there is assistance provided to those people that are not moving, I put it that way. Obviously, we're also concerned with the most vulnerable of the people that are on the move, and one doesn't negate the other. But I wanted to make sure that we do understand there's a need for assistance increasing along both sides of that issue.
Thank you very much. There's a question here, which is about, I think it's related to one of you, I think, mentioned the fact that some of the strategies that we use in conventional conflict settings, such as negotiating with armed actors or negotiating access to people who need our assistance, can be adapted to some of the contexts anyway that we're working in the region. And one of the questions here is related to contact with or looking at the strategies of the maras themselves, the gangs themselves, in terms of how they engage with people, track people. I mean, engage is a very euphemistic term, but I mean, can any of you say anything about that? I mean, I know it's a sensitive issue, but can any of you say anything about whether there is any direct engagement or what sort of engagement there might be? You want to give me
I could speak to
If you
that.
like, I
Yes,
want-
Noah. Yeah, start Noah, and
Okay.
then Christian. Yeah.
One of the things that it's funny in some ways, I guess. The president of El Salvador says that there'll be no negotiation with gangs, but on a daily basis, that on the other side of the coin, every single citizen negotiates almost every single day in some aspect with criminal organizations. That's part of territorial control. And so where you can go to work, where you can go to school, where you can go visit friends or family members, any number of things like that are things that you negotiate directly or indirectly, often with criminal organizations. So humanitarian development, human rights organizations on the ground have been, I wouldn't call it negotiating, but there are things that are spoken, we dialogue with the gangs with in order to get access. And that's just part of life. And at the same time, when you're trying to assist somebody who's fleeing gangs like that, then you need to be able to generate a break from the control. That's part of what has to happen. You have to be able to extract somebody and almost disappear them when they're suffering a high level of persecution. One of the things that we've learned is in dealing with the gangs is that sometimes death and displacement or disappearance are three things that for the gangs, if they are threatening somebody or persecuting somebody, those are three outcomes that are acceptable because the authority of the gang is no longer being challenged by the ongoing presence of that person. I don't know if I'm being clear, but in a sense, they may threaten to death somebody, but it actually is just as good that that person had to flee because the authority of the gang is not challenged by that person anymore. And so we look at different cases that sometimes break that mold, and there are cases in which the gangs will hunt down, they will more actively persecute people, and a lot of those are related to sexual violence, sexual slavery. Oftentimes, when a woman who has been raped over multiple years or multiple times becomes pregnant, the child that's born out of that type of exploitation is something that the gang will look for. And we've seen that on multiple occasions. So there are different types of violences or situations that the gangs will more actively persecute, but at the same time, sometimes there are scenarios where a displacement or a disappearance or having left the country is good enough.
Thanks, Noah. Christian, did you want to add?
Yeah, I think well, Noah already mentioned several of the points, but also one of the things that we were internally challenged a lot on was particularly the security of operating in these area. Many times, the gangs and the maras and the different armed actors are understood largely as having not following any kind of logic. What we've experienced though is this is very similar many times to an armed conflict in the ways that they are largely trying to protect their control over a neighborhood, over an area. So providing humanitarian assistance that is perceived as being neutral and beneficial to the let's call them civilians in this neighborhood is allowed. Just like in Colombia, we are not allowed as a humanitarian organization here to negotiate directly with any of the armed actors in Colombia, any of the guerrilla movements of anyone else. So we are left with having to understand the situation and to also understand that implicitly the community leaders of these specific areas are the ones that provide us with a green light or not, after having being forced to consult with the armed actors that control any areas. And what we've seen then is that we can actually go into these areas, where many areas that were believed that were not accessible. So I think, and that's also been also documented in reports, also mentioned before here, the international crisis groups, the way in which these groups operate, extremely violent, but still there is a logic to the violence, and that logic operates within a similar logic to an armed conflict. That understanding that allows us to work. Of course, there is risks. This is extremely fragmented, and a very dynamic and changing situation. So it challenges you as a humanitarian actor, and that is the type also of knowledge that we have been engaged in, maybe transferring to local actors for them to also better manage and mitigate the risk in which they are facing.
Thanks, Christian. Mark, did you want to add anything? Sorry, I think you're muted.
Yes, in line with what Christian and Noah said, from our perspective, engaging and delivering assistance in areas controlled by gangs, maras, or criminal organizations, basically it follows the same approach than in conflict settings. We use a principal approach based on neutrality and independence, and we use as well an analysis and a dialogue based on what are their position, what are their interests, and how do we deal as a humanitarian organization with those interests and the interest of MSF of providing assistance in certain areas. So it's possible. It's needed both in terms of access and in terms of security, and it's not so different from what we do in other conflict settings. The issue of the negotiations through the community is another relevant aspect in this kind of context. And I think that, definitely it's this indirect negotiation or this indirect approach definitely it's needed when sometimes the criminal organizations that want to appear themselves as an actor to engage directly with a humanitarian organization. But this is one of the particularities of working in this type of context, and we as humanitarian organizations have to acknowledge it and have to adapt basically in order to provide effective assistance.
Thanks, Mark. Wendy, I've got a question here from Marie Carmel Galinas, who's a program officer for Central America from the Government of Canada. and I'm going to start with you, but she's wondering if the panelists could give their perspective as to how the violence in these particular contexts affects women differently than men. I mean, we've heard some of you talk about some of this, but maybe you could just go into more detail about that.
Thanks for the question. If you look at the homicide rates, they're predominantly men, and there are some interesting statistics also in terms of the kind of gender breakdown of people on the move in terms of migration and crossing borders and asylum seekers. Understanding that even if those figures are predominantly male, many of the families that are left behind are female-headed households. Again, the area, Central America, is affected a lot by migration in terms of seeking employment outside of the communities, and you see that often it's women that are left taking care of the children and taking care of the household, and so we have a very differential impact on how the violence is affecting women's availability to cope and to ensure adequate livelihoods for their families.
Thank you. Noah, do you want to add anything to that?
I mentioned in my last intervention the role of sexual slavery and sexual gender-based violence in driving displacement. I think that Wendy alluded to the violence or the homicide rate in El Salvador, which predominantly affects men. And one of the things that we do often is when we talk about violence, what we're actually talking about is homicide rate. But what drives displacement are multiple violences. And a lot of those violences that become invisible by the heavy focus on homicide rates are those gender-based forms of violence. And so I think that there becomes a discorrelation between homicide and displacement. For example, here in El Salvador, there was a period of about 2 years that there was a gang truce in which homicide rates were greatly reduced. But that was one of the points of time when we began to detect at higher rates displacement. So you have to begin to explain displacement using other forms of violence as drivers. And one of the things that we hear in families as a trigger is when the women, be it the children, the wife, the girlfriends, are being threatened for sexual exploitation or violence perpetrated against them. Those are one of the things that breaks that threshold. Salvadoran families have high thresholds for insecurity, but when family members are faced with mass rape or forced into relationships with gang members or gang leaderships, those are things that make families move. And I think that's one of the parts that, like I said, when we focus on violence and we compare the homicide rates with Syria, but that's not the only type of violence that is driving displacement. And women are the heavy targets, obviously, of the sexual and gender-based violence that does drive displacement in El Salvador.
Yes. I'd like to go to Wendy. Yes, you have your hand up. Go ahead.
I just wanted to come back on this. I mean, despite, as Noah mentioned, the homicide rates affecting primarily men, it does, in the region, are some of the highest femicide rates in the world. And it's the reason why we've chosen the 3 countries as the place we're trying to roll out the new interagency standing committee gender-based violence guidelines to ensure that there is that these guidelines are included in humanitarian assistance. Because what we're seeing also is from the displaced population, a high percentage of women are reporting having been victim of gender-based violence during displacement. And this is documented, I think, in one of the UNHCR's recent reports of women on the run. And so we want to ensure that it is incorporated into all dimensions of humanitarian assistance in the region.
Thanks, Wendy. I mean, we're running out of time now, but I do have a question from Fotini, who I think is a former OCHA colleague. And Fotini would like to ask you, Wendy, specifically, you mentioned briefly the response to the European refugee situation. and she's not calling it a crisis. But to what extent do you think that the media focus on Europe has diverted attention from Central America? Or on the flip side, could it be convenient not to focus on Central America, as ultimately it's an issue for the U.S.? So this is a question from Fotini.
I think that's been traditionally the view about humanitarian action in Latin America, that it is under a heavy sphere of influence and responsibility of the United States. But that's not in line with kind of global humanitarian assistance should be according to need and not according to where it's happening. Definitely there's been a diversion of attention, not just for the migrant situation in Europe, but also other crises. And I think that we've increasingly heard some of the humanitarian donors saying that they need to answer to their constituency, and so they need to answer to more pressing humanitarian concerns closer to their borders. And also the perception that it is the responsibility of the state, and these countries being middle-income countries, classified as middle-income countries, they should have resources to provide the systems themselves rather than different donors. So I think there's multiple factors there. I think what we should be, as a humanitarian community, advocating for is really that there's a different way of thinking about migration, and that it brings a lot more to the countries than it's perceived. It's really an economic opportunity for these countries to have more open borders and decrease the number of asylum seekers that they accept, rather than seeing it as something that should be stopped.
Thank you. I'm going to ask Christian one more question. Of course, others can add quickly because we've just got a few minutes left. But Christian, we've got a question from Lucas, who says that you mentioned that humanitarian organizations operating in the region previously focused on reduction of risk from natural disasters. And there's a need for increased technical capacity for operating in conflict-affected settings. And Lucas would be interested to hear from you or others on the extent to which you think there are connections between climate-related risks and the violence in the region. He's thinking about impacts on rural livelihoods, urbanization, etc. Do you want to take a stab at that?
I can start, and I'm sure Wendy and the rest would help me develop that idea. But I believe, and I think it's also been established, and also in different reports, that there is a connection between them. I think both El Salvador and Honduras are some of the most vulnerable countries in the entire world when it comes to climate change, and we just been through a several years long drought, and there are other risks that I think pushes people from rural livelihoods into urban areas where you have this very complex conflict situation, and also I think somehow contribute greatly to the flow of people. As has been mentioned, you have a large number of people going on a migration or displacement route every year, and also a large number of them being deported back to these countries, many of them immediately trying to leave again. So you have I think you have a very complex interaction between the lack of development, which also is the lack of adaptation to climate change and to needs that arises from natural phenomena, and this and the situation of violence, largely in the cities, but which you also can find, and I think Noah would not know much better, but also the violence which you have in El Salvador is not only present in the biggest urban areas. It's also being now expanded into what you could call rural areas, and that we also see in Honduras. The security, the response to increased operations in the urban areas has also displaced some of the maras and some of the criminal gangs to semi or rural areas. So there is a clear interaction, I would say.
Thanks, Christian. Anybody else like to comment on that? Maybe you could just indicate by raising your hand. We've just got 1 minute left, actually. Mark, go ahead.
Yes, I will try to address both the last two questions. I think that we have to acknowledge that the situation in Europe draws too much attention compared with what the needs are. In this case, I mean, as a MSF, we have to acknowledge that. I mean, by talking on what's happening in Europe, we are forgetting about the huge humanitarian needs on the countries of origin in the Middle East and the root causes of these people I mean, moving across the Mediterranean and entering Europe. I mean, the point and the problems are in the Middle East affected war countries. And I mean, by pointing too much on what are the problems in Europe, we are forgetting as well this origin of the crisis, and we are forgetting as well those other crises like what's happening in Central America and what's happening in Mexico when people is fleeing violence. And I would like as well to put the emphasis on the main cause of people fleeing, and this came of the survey that we made, and it's that 40% of people is leaving Central America because of violence. The threats, their life is at risk. So yeah, climate change could have an impact, but I think that what's distinctive of this crisis is the huge levels of violence that are pushing people to save their life out of their countries. And I think that this is something that has to be acknowledged and has to be responded by the governments in the region.
Thank you, Mark. Wendy, one last word. Go ahead.
Yeah, thanks. Just quickly, I mean, I think as Christian mentioned, that a large part of the humanitarian response in Central America was at the root of a large, mega hurricane, the impact of Hurricane Mitch. And what we're seeing is that with climate change, we're even more susceptible to either more frequent or more intense hurricane hitting the region. And the question is, if it hits a region and it affects communities that are effectively under control of criminal gangs, how will we access them? And that's why it's even more important that we're continuing to make those contacts with people living in those communities. And I think, secondly, where does it really start? This violence that's causing the displacement, and it's obviously rooted in the rights. So we have to. In violation of human rights, we have to work hand in hand with providing assistance and protection now to save lives and to alleviate some of the suffering of those communities, at the same time as encouraging other actors to work on some of the fundamental causes, which are land rights, access to reproductive health, and some of the other issues.
Thanks very much. I think unfortunately, we're out of time, and we had several more questions. So we had a lot of interest from the audience who's been with us today. I'd just like to thank all of the panelists for spending this time with us and for the really interesting discussion that we've had. I'd like to thank in particular the participants who've come from the region. We have many people watching from the region, and we had a comment from Geronimo who was saying who thought that the webinar should have been discussed in Spanish because that's the language in Central America. And I just wanted to say that I know Wendy has plans to try to organize an event in the region. We had a public launch event at the Wilson Center in Washington, and I urge you to watch that video because that was also very interesting. Wendy and Noah also participated in that event. And the Spanish edition of this of the exchange should be ready at the latest by early next week, and that will be posted online. So please look out for that. But I very much take the point that this discussion also needs to take place in Spanish. But I think that it's important also to make the rest of the world in areas that maybe aren't Spanish speaking aware of what the issues are that you're dealing with there in the region. So thank you again, and I'll look forward to our next webinar. Thank you. Bye-bye.